by Angela Makris. Unfortunately, she cannot be with us today, so it will be a recorded video. However, you still have a chance to engage with the content through a discussion at your table. So I'll get you all to think, pair, share, and I'll walk around and just facilitate a little bit of a discussion before we move on to the next presenter. So we'll just allow 10 minutes for that. So without further ado, I will get the video up and running.
Hi everyone, I'm sorry I cannot be physically there today. As much as I wanted to come home, some unexpected personal issues kept me from travelling. Today I will be taking you through a portion of my research titled Exploring Social Support and Family Wellbeing through Family Routines for Parents of Autistic Children. I chose to focus on routines to get a deeper insight into the day-to-day life of the parent carer to better understand not only the type of support a parent will need, but when and why parenting an autistic child. My aim was to provide insights from my research to make me a better social marketer for people with disabilities and their carers. Throughout my presentation, I will be using identity-first language. Today, I will be talking about routines, autism, parental stress, my study, the results of my study, and the impact these results have on social marketing. So let's get started. So we are on the same page moving forward. I will be quickly reviewing the definition of routines, habits, and rituals on this slide to provide context for the rest of the presentation. A habit is primarily an automatic behavior done without conscious thought. For example, taking your shoes off as soon as you get home. A routine is a regular sequence of events, for example, drinking a cup of coffee in the morning before the day starts. A ritual gives a routine meaning. In this instance, for me personally, the first cup of coffee for my day is always at 7 a.m. from a particular cup sitting in a specific chair. Now, family routines are a little bit different. Family routines are structured patterns of activities that are repeated regularly in everyday life. These include bed, bath and meal, and playtimes. By establishing consistent routines, families can create a supportive environment that promotes well-being and positive relationships. In particular, these routines help children develop time management and attention skills, fostering a sense of security and stability. Stable family routines are good not only for the health of the family, but for the community as well. As a background, autism is a lifelong condition that has no cure. The data on the left outlines some of the characteristics of an autistic person, such as challenges in social interaction and stereotypical patterns of behavior. On the right is the prevalence of autism in both the US, where my study was conducted, and in Australia for local context. The increase over the years for both countries is in part due to changes in the diagnostic criteria. These changes in prevalence make autism a public health issue and was a major reason for me choosing this area of research. The way data is collected in each country is slightly different, therefore so is the way the data is presented here on this slide. For Australia, the prevalence of autism is reported by Australian Bureau of Statistics and the National Disability Insurance Scheme, and what it shows, it has increased by nearly 1% between 2015 and 2022 for children between the ages of 5 and 9. For the US, the rate of children diagnosed as having autism at age 8 has increased from 2016, when it was 1 in 54, to 1 in 31 children by 2022, and this data was provided by the CDC in 2025. The next slide will show the impact the diagnosis has on the parental arc of responsibility. The parental arc of responsibility is very different if you have a child that is autistic. Family structures their routines around the autistic child because of their inflexible daily routine. As a lifelong diagnosis, the support of family needs varies. The autistic child may not meet the milestones of a neurotypical child, and some children may live independent lives without needing family support, while some parents become lifelong carers. The challenges of the parents start very early, with difficulty in the child acquiring language, being potty trained, interacting with people, and exhibiting restrictive and repetitive behaviors, all of which impact family routines. These challenges may or may not decrease as the child gets older. Parents of autistic children come to rely on social support more to take care of their child, and there is a growing shift towards online social interaction for parents who are unable to find traditional face-to-face support. Research in this area is still in its infancy, and because I will be focusing on social support, I would like to share the type of support I focused on and its definition. But before I do so, I just want to let you know, show in greater detail that the parental arc of responsibility is longer and more intense, which is why research in this area is very important. Now, social support is basically, in my research, perceived social support. And the particular types of support my research focused on was informational support, providing information, learning, resources, or advice. Emotional support, providing expressions that include care, love, empathy, sympathy, that support a parent's sense of well-being. Appraisal support, which is evaluative feedback regarding skills, abilities, and intrinsic value of being a parent. And companionship support, which is the enhancement of one's sense of belonging. And tangible physical support, providing needed goods and services to meet the physical or life skills needed by the child. Now, in the US, the data on parents of neurotypical children who seek information on social media is robust. In 2023, a report showed that the main areas parents searched for help was toilet training, getting kids to sleep, and breastfeeding, as reflected in the data on the right. Over the past 5 years, at least, the prevalence of sources of parenting information to emerge with social media are accounts authored by parents with autistic children. Understanding how effective this form of support is also in its infancy. There is limited research on its effectiveness or not, which is why I wanted to focus part of my research in this area. My research aim was to identify the tangible effect of social support on everyday parenting routines and the potential ways social media is used, and if it's fulfilling a need for social support that cannot be met by more established supports. To explore the probability of social media as a form of social support to help improve public health initiatives, there is a need to understand if and how the community leverages technology to understand and accommodate this permanent shift facilitated by social media in society. My study purpose was to explore how parents of autistic children use social media as a form of social support. I had 3 research aims. The presentation will focus on my findings for Aim 3, which is to explore the potential mediating effects of social media as social support. Now, I conducted the study using the social marketing framework to explore the significance of social support as a place where parents go to find support to sustain a family routine. While the eco-cultural theory explored how parents do parenting, the accommodations parents make, and the support used to sustain a family routine. Eco-cultural theory is a lens to explore what families with autistic children are already doing in their daily routines, if and how they adapt to competing resources, beliefs, and values, and the needs and abilities of the individual family members to understand a routine. Disability in this theory is not seen as a disruptor in the family unit because the locus of research of daily lives attends to people's narratives of their lives and the meanings they attach to them. Social support theory was applied to understand what elements are adapted or used as a stress buffer when family routines are disrupted. The social marketing approach focused on the idea that place can be used to segment an audience by focusing on where and when the target audience gets what type of social support to sustain family routines. Now, what I really liked about eco-cultural theory is that it treats family as a verb and not as an inflexible institution. The focus on accommodation is one that I also thought worked well with the social marketing framework. Family routines and rituals are influenced by context and can therefore be quickly adjusted to the demands and opportunities of a family living situation. Family routines make sense to families. They can easily recall how they conducted them and identify instances of disruption and adaptation of these family processes more readily, limiting recall bias. Eco-cultural theory measures success in terms of accommodations made rather than behavior, which could potentially yield better outcomes when conducting research with vulnerable communities. And what I also like is the accommodations are not assumed to be positive or negative, but the goodness of the accommodation depends on the long-term outcome of the family routine. Now, the diagram in this slide is a snapshot of what I was researching. How do families sustain a routine? And when a family routine is disrupted, what accommodations do they make and what supports do they use? Now, I did that through an exploratory multi-method qualitative design. For background, for the semi-structured interviews, which is part 1, I focused on routines, the sources of their social support, and their social media use. For phase 2, the diary component, the focus was on the parents' social media use, Essentially, the parents used an app to document their social media use on their phone from the prompts I provided to guide them. Now, the data analysis was constant comparative analysis for the interviews, and for the interviews and the diary data, I applied reflective thematic analysis. The inclusion criteria, as you can see on the right, were quite broad. What was specific was that the participants needed to be parents, not a carer or a guardian. I wanted the millennial parent because of their high use of social media. I did not look for a specific autism diagnosis for two reasons. Firstly, the diagnosis has changed in the last 20 years, and secondly, I am focusing on the parent who does not see the diagnosis but the accommodations they need to make to ensure their child's well-being. My recruitment was done through basically four ways: word of mouth, Facebook, for basically 2 Facebook groups on autism, and a listserv which provided 6 participants. The research was conducted between October and November of 2024, and as you can tell on the right is a summary of the study participants. Even though the diagnosis has ranged from 3 months to 17 years, they all had a similar way of viewing the role social media played in their lives. I will now look at the sources of social support that resulted from this research. I have created a conceptual map of the research findings, which needs more than a minute, of course, for you to review it. So I will highlight the main areas of interest and then elaborate on them in the following slides. The main areas impacting parental stress were parental experience, which starts at the point of diagnosis, how quickly a child started formal supports, such as occupational therapy, the proximity of these supports, and the accommodations made by the parent. I will now take a deeper dive in 4 of these outcomes. Even though my research focused on social support, the parents highlighted the significance of formal support, such as occupational therapy, in helping the family not only maintain, but create routines that work for everyone. Formal supports were mentioned by parents as being crucial to decreasing their stress levels, aiding the child's progress, and enabling the parent to manage the child at home through emotional regulation, learning how to eat with utensils, and how to communicate with their child. Formal or actual supports impacted the type of social support required by the parent. Now, all participants spoke about their emotional and informational support in terms of access to them. Emotional and informational support was extended for family and friends who may be geographically far away or the parent was not able to physically see them, through the use of Facebook and WhatsApp to stay connected. When looking at the proximity of support, the easier it was to access, the more it was perceived as support. The geographic proximity of Facebook groups made it possible to check for misinformation as well. You will see on the right that a local church of one of the participants offered online services, which she accessed when she could not leave their house, enabling this faith-based support to still be accessible and therefore close in proximity for the parent. In the next 2 slides, I will show you what the parents used to search for in terms of support on Facebook. I have taken these 2 examples to highlight the multidimensional proximity of support. The image on the right is the allied healthcare facility that one of the parents takes their child to. The Instagram site provides added information and advice for autistic children, which she refers to when needed because it is both local and trusted. The image on the right has 2 areas of interest I want to bring to your attention. So the first is the overall Facebook group is for Tampa Bay region, which is around 400,000 people. Within that page is a post from the city of Largo, which is at most an hour's drive from the furthest part of Tampa. A trusted page, locally relevant and easy to check for valid events. This image is a snapshot of the mobile ethnography app dashboard where the parents uploaded their day and their social media use as it relates to their child and the parents. The searches are reflective of the time the interviews were taken, which is October-November, as Christmas was approaching. What you see is a mix of searches for sensory safe Santa to sensory safe friendly autistic events in the area, as well as looking for information on therapies. So for all these images and posts were for information seeking when parents were prompted by asking, how do you use social media? But now I will take a look in particular the role social media plays as a form of social support. As you can see, there is a bit of a paradox. Of the 19 participants, the 13 participants found that social media was a great place for information and emotional support. Yet 6 of these parents were also part of the 12 parents who were skeptical of the information presented on social media. The attraction was the information and community connection. The avoidance was the distrust of information and the lack of community acceptance and inclusion. What is important is that the findings show that parents' relationship with social media was divided. Even though they knew there was a lot of bad information and judgment, they still saw it as a way to stay connected to family and friends, as well as gain information or help others. Following are 2 slides that show in more detail the social media paradox. Social media was used primarily as emotional and informational support. The most common platform used was Facebook for the millennial parent. The more recent the diagnosis, the broader the social media access was by the parent. Social media use actually decreased as lived experience increased for the parent. With experience and the help of formal supports, the parents started to use Facebook with more purpose, with geographical proximity being key for 2 reasons: the ability to access the support the parent needs, and the ability of the parent to easily filter misinformation from the posts uploaded. The main aim of social media use in this instance was as prevention of a routine disruption, as we also saw from the searches the parents undertook in the previous slides. Now, social media served to stress parents out as they came to the realization that their child would never meet the traditional milestones of their fellow neurotypical family friends. Parents chose to purposefully take breaks from social media, regardless of how long it had been since their child's diagnosis, to prevent parental stress. Such breaks would occur during key childhood events such as the first day of school or graduation, when there was a fear of social comparison, and to prevent misinformation feeds in their platform of choice. Therefore, getting off social media was a way to prevent stress. So why are the results from my study important for us as social marketers? Where there is a disability, there's an informal carer. The data on the left shows why social marketing should start making more inroads in the disability sector. With 16% of the global population disabled and 1 in 5 people in Australia, that means that there are quite a large amount of carers who support those with disabilities. And as a social marketer, we can play a role in supporting informal carers through a public health lens. The column on the right represents carer data for Australia, which reveals that the need for more public health initiatives aimed at carers, as the data highlights both their mental and physical health is impacted. So, what can we do as social marketers? I am so glad you asked. Basically, we can start by adding eco-cultural theory to our toolkit. It's a particularly well-suited theory for social marketers because it shifts the focus from changing behaviors to understanding and adapting to the daily routines, values, and cultural practices of targeted populations. This perspective brings several advantages for designing more inclusive, relevant, and sustainable public health interventions. It's contextually relevant, it enhances the sustainability of social marketing efforts, and focuses on strengths and accommodations, leading to greater equity and inclusion. Rather than prescribing changes, eco-cultural theory recognizes that routines are shaped by the opportunities and constraints of the family living situation. This perspective enables the development of tailored strategies that respect and support the accommodations families already use, providing a more realistic and empowering approach to a social marketing intervention. Eco-cultural theory has 12 accommodations listed that can be used as a starting point for the targeted community and has an interview guide that has been tested for over 30 years, both of which help with maintaining fidelity of the theory. Also, it was created in the disability sector and is very much about equity and inclusion. I will now focus on segmenting by supports as a practical example of how eco-cultural theory can work. Segmenting by supports provides a lens into what the community needs to decrease parental stress. In the diagram I provide, the segmentation came from my research. High social media use was associated with low access to support, in particular formative support such as therapy, while high access to support and low social media use was an indication of strong parental experience and access to effective formative support. The lower left quadrangle, which is at the time of diagnosis before a parent starts to use the internet, is where social marketers can help. Because eco-cultural theory accounts for the familial, institutional, and environmental systems, it is an ideal theory for midstream social marketing, where the focus is on influencing support networks rather than the individual alone. We can take our experience as social marketers and take midstream social marketing online. As you saw from the results of my research, parents are organically creating their own geographically relevant social media support groups with diverse stakeholders on Facebook. This is very different from an online patient community that focuses on a particular health condition, and the focus is on the person or carer managing that illness, where health professionals moderate some pages while pharmaceutical companies sponsor others, at least in the US. I will continue to use parents of autistic children in my example. As you will see, it can apply to most types of informal carers, yet in theory, formal carers can benefit too. The co-creation of online support with parents is a support that can be used and amended as needed in real time, transferring real-world experience online and vice versa, through appropriate platforms to provide safe spaces for the valid information of services and easy to access resources at the time of diagnosis and beyond. The key is to include the voice of the parent's lived experience when designing an online resource in the medium that the community uses most. And I'd just like to point out in this diagram, you will see that the line around this is because of the geographical relevance of all the stakeholders that need to be included. What is also important is that not only do these stakeholders provide an output for the parent, but the parent also has an input, being able to comment on the allied health services, the medical people, and the community and the business groups in their area. So for the millennial parent, Facebook would be the most effective medium. The pages created should be geographically relevant, as I keep saying. This form of support co-creation is well suited for rural areas where support, both formal and perceived, may not be as readily available or easy to find. The online resources can be replicated across various geographic locations using a similar template for each suburb or council. This model can be applied not only to families with an autistic child, but it can also be applied to families with a disabled family member or carers of adults with a disability. Potential benefits for the parent and carer are reduced isolation and stigma, adherence to treatment plans for the disabled person, increased emotional well-being and agency. For the stakeholder, it gets real-time information on community needs, it amends services offered as needed, engage productively with the community, and it also is held accountable by the community, as I showed you here with the feedback the parent provides. So online midstream social marketing can go a long way to decrease carer stress and mitigate carer paradoxes. The timing of the diagnosis and access to reliable formal and informal supports is crucial in managing parental stress levels throughout the child's life. Parents are navigating two key paradoxes: the information paradox, struggling to filter, interpret, and apply the vast and often conflicting information available about autism, and the social media paradox, balancing the benefits of online support with the risks of misinformation and emotional strain. An online midstream social marketing initiative that is geographically relevant can potentially decrease carer paradoxes and associated stress. So for the second to last slide, the research findings show that social media's potential as a tool for enhancing social support and the importance of understanding the crucial role technology plays in everyday life is crucial. Much of the application of social media to date for social marketers has been in promotion and rarely as a place or as part of the social support the targeted community may need. More qualitative research delving into the way supports are used at a granular daily level, the role, if any, technology plays for the carer, and how the access to formal support shapes and influences their digital interactions would provide valuable insight for public health initiatives to decrease stress levels of parents of autistic children and more broadly to carers. By focusing on everyday life research, the messy real world of how carers navigate this messiness in the family context can provide a strengths-based approach to future public health initiatives through the social marketing framework, which aims to help decrease stress for the parent carer through viewing the family as a health promotion setting. Thank you to the conference organisers for the ability to present virtually, and I'm really sorry I cannot be there to take any of your questions you may have about the presentations, but please do not hesitate to reach out to me via email. Take care and enjoy the conference.
Yes, so it's unfortunate that Angela couldn't be here in person to answer questions. She's unfortunately having to undergo treatment for breast cancer, so she will be online at some point. Her presentation, important work, very interesting. Unfortunately, ran over time, so that gives us less time to have a discussion. But still, it would be worthwhile just, turning to the person next to you, introducing yourselves, and just what are your, top takeaways from the presentation. And yeah, just give us 5 minutes to do that. That's all the time we have, unfortunately.